So, hello viewers, welcome once again to my YouTube channel. And in succession to the videos what I have been taking up in pharmacology, so today's video will be mainly discussing upon the classification of the drugs what are used in the treatment of hyperthyroidism. So, the drugs what are used in the treatment of hyperthyroidism can be broadly classified on the basis as to on what step so these drugs are acting. So basically these drugs, they can be classified into the different categories based on what at what site of the thyroid hormone synthesis or on what site of the thyroid gland these drugs are acting. So firstly, these drugs, they can be classified into the first class of the drug is the thyroid hormone synthesis inhibitors. So students and viewers, do remember the first drug, the first classification, it is based on the drugs what are basically going to act on the thyroid hormone synthesis inhibitors. So they are also called as the anti-thyroid drugs. Why? Just because they are going to inhibit the synthesis of the thyroid hormones, and particularly out of in this category, the drugs what fall in this category are the thiamides or the thiourea derivatives. So students and viewers, do remember the thiamides and the thiourea derivatives are the drugs what are used as the chief drugs what are used in the to inhibit the thyroid hormone synthesis, and they are basically the propyl thiouracil, the methimazole, and the carbimazole. So students and viewers, do remember the most commonly drugs, the most of the doctors what they prescribe, it is the thyroid hormone synthesis inhibitors, and in this category the two very important drugs which fall, it is the methimazole and the carbimazole. Next, we have the inhibitors of iodide trapping. So you must have read in physiology that during the synthesis of thyroid hormones, it is one of the step is where the trapping of the iodide is going to take place within the thyroid gland in the synthesis of thyroid hormones. So iodide trapping, it is very one of the important steps where in the synthesis of thyroid hormones, so inhibitors of iodide trapping, these are the drugs which fall in this category are the thiocinates and the perchlorates. Next, we have the hormone release inhibitors. So one drugs, the first classification is based on they are going to inhibit the thyroid hormone synthesis. But this hormone release inhibitors, there are certain drugs what are going to the hormone, if it is getting formed also, these drugs are going to prevent the release of the hormone. So they are called as the hormone release inhibitors, whereas the first class of the drugs was thyroid hormone synthesis inhibitors. So one class was they are going to stop the synthesis of thyroid gland. The next class, it is the hormone release inhibitors. So they are going to inhibit the release of the hormones, and in this category the most important drugs are the iodine, the iodides of sodium and potassium, and the organic iodide. Next, the next class of the drug for hyperthyroidism is the thyroid tissue destroying agents. So under this category of thyroid tissue destroying agents, we do have the radioactive iodine, particularly the iodine, the isotopes, that is the iodine 131, the iodine 125, and the iodine 123. And lastly, there are certain these beta blockers, particularly the propranolol, the atenolol, the diltiazem, and certain corticosteroids, that is the dexamethasones, they are also used in the treatment of the hyperthyroidism. So students and viewers, this was a very short discussion where I have given you in simple terms, in simple classification, which is used, the drugs what are used in the treatment of hyperthyroidism, or the classification of the drugs what are used in the treatment of hyperthyroidism. So students and viewers, this was a very short discussion. If you still have any queries or comments, you're most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe. If you like this video, give this video a thumbs up, and don't forget to share amongst your friends. If you like this video, give this video a thumbs up. Thank you for watching.